and I support your decision. Oh, baby!
If you are looking for birth control, here are different methods to prevent pregnancy. First is long-acting reversible contraception.
Intrauterine device is a piece of T-shaped plastic about the size of a quarter used for birth control. It is inserted into the uterus where it stays to prevent pregnancy.
The advantages of intrauterine device can cut down on cramps and make your period way lighter. Some people totally stop getting periods at all. Hormonal iodines can help treat people who suffer from severe cramps, really heavy periods, and anemia.
Implantable rod is a small flexible plastic rod that's placed under the skin in your upper arm by a doctor. It releases the hormone progesterone into your bloodstream to prevent pregnancy and lasts for 3 years.
The advantages of implantable rod. It is the most effective method of contraception. Once inserted, put in, you can forget about it for 3 years. Many users have no vaginal bleeding at all or very light bleeding. Periods may be less painful. Acne can improve. It doesn't interfere with having sex. Hormonal methods.
Depo-Provera is a contraceptive injection that contains the hormone progesterone. The hormone in the shot stops your ovaries from releasing an egg and thickens your cervical mucus, which prevents sperm from reaching the egg. It also thins the lining of the uterus, preventing implantation of a fertilized egg. Depo-Provera CI is moreover an intramuscular injection, shot injected into a muscle, and is used as a contraceptive to prevent pregnancy. Depo-Provera does not protect against HIV infection or AIDS and other sexually transmitted diseases. You should remember that.
The advantages of Depo-Provera. Doesn't require daily action, eliminates the need to interrupt sex for contraception, decreases menstrual cramps and pain, lessens menstrual blood flow, and in some cases stops menstruation, decreases the risk of endometrial cancer.
There are 2 different types of progesterone-only pill. One is 3-hour progesterone-only pill must be taken within 3 hours of the same time each day. For example, Norgeston and Noriday. Next is 12-hour progesterone-only pill or disogestrel pill such as Cerazette must be taken within 12 hours of the same time each day.
The advantages of progestin-only pill and combine oral contraceptives, reduce menstrual cramps, lighten periods, and lower your risk of ectopic pregnancy. The combination pill can also help prevent or lessen acne, bone thinning.
Contraceptive patch. The contraceptive patch is a small sticky patch that releases hormones into your body through skin to prevent pregnancy. The patch releases a daily dose of hormones through the skin into the bloodstream to prevent pregnancy. It contains the same hormones as the combined pill, estrogen and progesterone, and works in the same way by preventing the release of an egg each month or ovulation. If you have heavy or painful periods, the patch can help. The patch can raise your blood pressure, and some women get temporary side effects such as headaches.
It eliminates the need to interrupt sex for contraception. You don't need your partner's cooperation to use it. It doesn't require daily attention or having to remember to take a pill every day. It provides a steady dose of hormones. It's easier to use if you have trouble swallowing pills.
Vaginal ring. The vaginal ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progesterone into the bloodstream to prevent pregnancy.
The advantages of the vaginal ring. It is convenient to use because it only requires the user to change it once a month. It is a good alternative to contraceptive, implants or intrauterine devices. Use of the ring is associated with a lower risk of intermenstrual or irregular bleeding. Barrier methods.
Condom, a smarter device used during sexual intercourse to reduce probability of pregnancy or a sexually transmitted infection. Adding condoms to your birth control lineup can give you extra pregnancy protection. No method is 100% effective, so adding condoms as a backup helps you prevent pregnancy if you make a mistake with your other method or it fails. Condoms are easy to find in drugstores, supermarkets, and even vending machines.
The advantages of the condom: widely available without prescription, inexpensive, helps protect against STDs, gives male partner more accountability for birth control. Both partners can participate in using it. No hormones.
Contraceptive sponge is a small, round, soft piece of plastic foam that's coated with spermicide. You insert it into your vagina before having sex. It covers your cervix and helps prevent sperm from reaching your uterus. People who want a hormone-free birth control option could benefit from the sponge. It is also good option for people who want to buy birth control without a prescription.
The advantages of contraceptive sponge: 86% effective, provide 12-hour protection, can be obtained at most drugstores, can be inserted up to an hour before sexual intercourse, does not require fitting with a health professional.
Spermicides contain chemicals to stop sperm from getting to an egg. They come in several different forms: cream, gel, foam, film, and suppositories. Spermicide may be a good birth control option for couples who can plan in advance of having sex and who want extra protection when they use condoms or other barrier methods of contraception.
Advantages of the spermicide: contain ingredients that disable sperm, available in various forms: sponges, creams, jellies, tablets, foams, film, and suppositories. Very effective when used with a barrier method condom. 82% effective when used alone. Perfect use. Sterilization.
Tubal ligation is a surgical procedure to prevent pregnancy. It has commonly been called getting your tubes tied. It is called a femoral sterilization. Tuba refers to the fallopian tubes. Each month, an egg is released from an ovary and travels through the fallopian tube to the uterus. Ligation means to tie off.
Tubal ligation permanently prevents pregnancy, so you no longer need any type of birth control. However, it does not protect against sexually transmitted infections. Tubal ligation may also decrease your risk of ovarian cancer, especially if the fallopian tubes are removed.
Vasectomy is a form of male birth control that cuts the supply of sperm to your semen. It's done by cutting umbilical tubes that carry sperm. Vasectomy has a low risk of problems and can usually be performed in an outpatient setting under local anesthesia.
A vasectomy is more than 99% effective at preventing pregnancy. Long-term effects on your health are rare. It doesn't affect your hormone levels, sex drive, or interfere with sex. It may be chosen as a simpler and safer alternative to female sterilization.
Sterilization implants are a type of permanent contraception for women. Sterilization implants are tiny, flexible metal vials that can be inserted into the fallopian tubes to permanently block them.
More than 99% effective at preventing pregnancy. Blocking the fallopian tubes and removal of the tubes should be effective immediately, but use contraception until your next period. It will not affect your sex drive or interfere with sex.
Han, I have seen videos on YouTube that advertise different methods to prevent pregnancy.
Hey, that's good to hear you.